This episode of the Burnout Recovery Podcast is brought to you by MEGA, your medical indemnity partner. Whether you're starting out in your career or have decades of experience, MEGA helps you thrive with support that goes beyond insurance. Enjoy travel benefits like complimentary travel insurance and Qantas points on your membership, plus education, medico-legal support, access to career coaching and wellbeing resources. Visit mega.com.au to learn more. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit mega.com.au. Busy day, quick question, no time to dig. Heidi Evidence brings the evidence to you. Clear answers with citations you can trust. Completely ad-free, unlimited and region-aligned. Find evidence in the chaos. Search HeidiHealth.com.
Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Joe Braid, a certified professional coach and rehabilitation physician.
Welcome back to the Burnout Recovery Podcast. I'm Dr. Joe Braid, and this is episode 175. Today, we're talking about something that might sound counterintuitive: creating your own personal burnout prevention plan. Because here's what I know. Recovery isn't just about bouncing back after you've hit rock bottom. Real recovery is about building a roadmap that helps you recognize the warning signs early, respond effectively, and prevent the next crisis before it happens. And for those of us who have been through burnout, so burnout is incredibly common in healthcare, and actually in Australian employees, it's over 40%. In healthcare professionals, it's often over 60% in surveys that are done. So you're not alone if you have been through burnout before. While your recovery roadmap will be unique to you, the warning signs, they are remarkably similar across all of us in healthcare. So today I'm going to share how to create your own early warning system, how to distinguish between personal and systemic burnout risk factors, and give you practical tools you can start using immediately. Let's dive in. So I'm going to do a parallel between fire readiness and burnout, okay? This parallel really resonates with me, especially living here in regional New South Wales, where bushfire preparedness is part of the annual routine. Think about fire readiness for a moment. We don't wait until we see flames to start preparing. We understand there are stages: hazard awareness, prevention, immediate response, and recovery. And I would suggest that burnout could follow exactly the same pattern. Firstly, hazard awareness. These are the warning signs. So just as a fire rarely starts instantly, but the risk of fire builds over time with dry fuel and the right conditions, burnout certainly is a cumulative process stemming from unrelenting, uncontrolled chronic stress, not a sudden event. For me, my early warning signs are disrupted sleep and difficulty concentrating. When I notice I'm lying awake at 2 a.m., mentally triaging my to-do list, or when I've read the same patient note 3 times and I still haven't absorbed it, that is my smoke detector going off. Your warning signs might be different. Maybe it's increased irritability with colleagues. Maybe it's a lack of focus. And maybe it's Sunday night dread eking in earlier in your weekend. Maybe it's relying more heavily on that 3rd or 5th coffee, or depending on a glass of wine at the end of the day. The key is knowing your specific warning signs, your personal smoke detectors. Secondly, prevention, creating defensible space. In fire readiness, they talk about fuel reduction and creating defensible space around your property. In burnout prevention, this is about creating buffer zones around your time and energy, such valuable currencies in our lives. So this means regular breaks, firm boundaries, leaving work at work, aiming to leave work on time, and practicing what I call prehabilitation. So you're investing in resilience before you need it, not scrambling to find it when you're already exhausted. Stage 3, immediate response when the fire starts. If you ignore the smoke detector, you risk a full-blown fire. In burnout terms, this is when you really need significant intervention, taking extended leave, seeking professional support, and making immediate changes to your work situation. Now, I've been there, and I can tell you it's far easier to respond to the smoke detector than to rebuild after the fire has consumed everything. Stage 4 is recovery and mitigation. After a fire, you don't just rebuild the same structure that burned down, and you revise your safety plans, you strengthen weak points, and the same absolutely applies to burnout recovery. If we don't change what we were like before, if we quit one job and go into a new job thinking we won't get burnt out in that without changing anything about our individual risk factors and potentially the system risk factors in that new environment, the chance of burnout is high. So it's about learning what triggered the exhaustion and changing your systems to prevent recurrence. And here's what's critical. Just like after a major fire, after burnout, often your system is somewhat weakened and needs care before being fully operational again, and you can't rush this phase. And this system I'm talking about is the human body and mind. So when we think about the 80-20 reality of systems versus individual factors, I don't think this often gets discussed in burnout conversations. The research shows us that approximately 80% of burnout is contributed to by systemic factors and only 20% by individual factors. Yet often the theme is that burnout is a personal failing. You just need better self-care. Have you tried yoga? Maybe you're not resilient enough. And that narrative is not only inaccurate, it's actually pretty harmful. So let's go through the workplace burnout risk factors, the 80%. Firstly, we've got workload and time pressure, unrealistic patient loads, inadequate staffing, and high administrative burden. Secondly, lack of control. So if you have limited autonomy in decision-making, inflexible schedules, and inability to influence workplace policies. Thirdly, insufficient reward. And this is not just financial, but we know that lack of recognition, appreciation, or career advancement opportunities are burnout risk factors. Breakdown of community, so poor team dynamics, lack of collegial support, workplace conflict. Absence of fairness, this is inequitable workload distribution, favoritism, or lack of transparency in decisions. And finally, value conflicts. So being asked to compromise quality of care due to time or resource constraints. These are organizational issues, and these require organizational solutions. So let's go through the personal burnout risk factors, the 20%, and these do matter. A selection of these include perfectionism and difficulty delegating, poor boundary setting skills, lack of personal support systems outside of work, neglecting our physical health and sleep, difficulty asking for help, and tying your entire identity to your professional role. So here's the crucial distinction. You can work on your personal risk factors while simultaneously advocating for system change. It's not either or, it's both and. So one of the tools I really like for assessing where you are is the Stanford Professional Fulfillment Index, or the PFI, designed by Dr. Mickey Trockle, who was one of the lecturers when I did the Stanford WellMD Director of Wellbeing program last year. This is a 16-item validated survey designed specifically for physicians, although it's valuable for all healthcare professionals. What I love about the PFI is that it doesn't just measure burnout. It measures professional fulfillment, which is the intrinsic positive reward you derive from your work. Because recovery isn't just about reducing exhaustion. It's about rediscovering what called you to this work in the first place. The PFI measures two key dimensions of burnout: work exhaustion and interpersonal disengagement. And it gives you a baseline, a starting point for your recovery roadmap. You can access the Stanford PFI online. It's free and takes about 3 minutes to complete, and I'll put a link in the show notes. So let's think about your personal recovery roadmap. Guess what? I've already made a burnout recovery checklist. So I made this checklist that walks you through this process step by step, and I just want to give you an overview of what's included. Firstly, where are you now? So I invite you to do a self-assessment across physical signs, emotional signs, and behavioral signs. And you rate each statement from 1 to 5, get a score out of 75 that tells you whether you're seeing early warning signs, experiencing moderate burnout, or in severe burnout territory requiring support. Then I invite you to assess yourself across my 4 pillars: mindset, movement, sleep, and support. So then you can see exactly where you need to focus your energy. Thirdly, you've got the recovery action plan, and this is where, it turns into actionable steps. Firstly, you can go for immediate actions this week, and I've got lots of tips in there. Secondly, short-term goals over the next month. Establish one firm boundary, create a support check-in system, and finally, your long-term vision over the next 3 to 6 months. Rediscover what you love about healthcare, develop sustainable routines, and build your resilient skills. This checklist also includes emergency support resources and a weekly tracking tool to monitor your progress, because recovery is gradual and tracking helps you see the small wins. So this is completely free to download. It's on my website, and I'll pop the link into the show notes. So that's my website /recovery-checklist. So, creating your own early warning system, I invite you to identify 3 personal smoke detectors. What are the first signs that you're heading towards burnout? For me, it's disrupted sleep, difficulty concentrating, and increased irritability. Write these down. Share them with someone who sees you regularly, a partner, a colleague, a friend. Give them permission to point out when they notice these signs. Often in burnout, it's the people around us who notice something's different to before than actually ourselves. This is your early warning system, and it only works if you actually respond when the alarm goes off. Next, let me leave you with 3 specific action steps. First, download the Burnout Recovery Checklist from my website and complete the self-assessment this week. Secondly, take the Stanford Professional Fulfillment Index and look for patterns. And thirdly, identify one systemic factor and one personal factor contributing to your burnout risk. For the systemic factor, ask yourself, what's one small way I can advocate for change in my workplace? And for the personal factor, what's one boundary I can set this week? And here's my invitation. Join us in the Healthcare Leadership Hub on School. This is a community of healthcare professionals who are committed to thriving, not just surviving in their careers. And when you apply to join, you'll receive a free copy of the Burnout Recovery Checklist, plus access to a community of peers who understand exactly what you're going through. I've got the link in the show notes. Share your recovery roadmap with one other person this week. Maybe it's a colleague over coffee. Maybe it's your partner over dinner. Maybe it's in our community online. Because when one healthcare professional recovers from burnout and builds a sustainable career, the ripple effect reaches patients, families, colleagues, and communities around the world. Thank you for investing this time in yourself. It's time well spent. I'm Dr. Jo Braid, and this is the Burnout Recovery Podcast. I'll see you again next week. Ready to take the next step in your burnout recovery journey? Visit drjobraid.com for free resources, all 150 plus podcast episodes, and information about my keynote speaking. Links are in the show notes. Your well-being matters. Protect the asset that is you. You know those moments where you're between patients, everything's moving fast, and you just want to double-check something without falling down a rabbit hole? Heidi Evidence helps you to get to a clear answer with citations you can see pulled from trusted guidelines, research, and even your own uploaded docs. It's completely ad-free, no sponsored results, no weird ranking, and it's unlimited, region-aware, and fits into the workflow you're already using. It supports your clinical judgment. You stay in control. Find evidence in the chaos. Search Heidi Health MEGA.com. Be your best you. Rely on MEGA for your protection and support, serving doctors for over 125 years through insurance, education, medical legal advice, and member benefits designed to help you thrive and succeed. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit MEGA.com.au.